Running a hospital is one of the most complex logistics problems in existence. On any given day, staff are juggling thousands of variables at once. Patients arriving, many without an appointment, staff availability across different shifts, operating room schedules, bed capacity, equipment, and supply levels. For decades, healthcare organizations have leaned on simple rules and historical averages to plan around all of this. It works, but it leaves a lot of efficiency on the table. The result is longer wait times, staff working overtime and burning out, operating rooms sitting unused, and care that gets delayed for reasons that were preventable. In this lesson, we're looking at how AI helps optimize these interconnected systems in ways manual planning simply can't match. Patient no-shows are a massive problem. They cost the US healthcare system an estimated $150 billion a year. AI models tackle this by analyzing historical appointment data, alongside things like appointment type, time of day, weather, patient demographics, and a patient's past attendance record to predict which appointments are most likely to be missed. Once a clinic knows that, it can act. High-risk slots can be strategically overbooked without creating excessive waits. Patients flagged as high risk can get extra reminders or help arranging transportation. And scheduling templates can be built so the appointments most likely to be kept land in prime time slots. Health systems using these predictive models report 15 to 25% fewer unfilled appointment slots. Beyond predicting no-shows, AI also helps match patients to the right appointment and the right provider. First, complexity estimation. AI looks at the reason for the visit and the patient's history to estimate how much time that appointment will actually need, so visits stop running over or finishing early. Second, provider matching. Based on the clinical need, AI can suggest which provider is the best fit, factoring in their specialization, how full their current patient panel is, and continuity of care. And third, dynamic scheduling. Instead of rigid, fixed time blocks, AI can adjust appointment length and spacing in real time as the day's actual flow unfolds. The emergency department might be the hardest environment in healthcare to manage, and AI is helping in 3 specific ways. First, arrival prediction. Models look at historical patterns, weather, local events, flu surveillance data, even social media trends to forecast ED volumes hours or days ahead, so hospitals can staff up proactively instead of scrambling after the fact. Second, triage enhancement. AI tools analyze a patient's symptoms, vital signs, and history to give triage nurses an extra, data-driven input, especially useful when things get busy and decisions have to be made fast. It doesn't replace clinical judgment, it supports it. Third, bed management. AI tracks patients in real time from arrival through treatment and disposition, predicting when beds will open up, which cuts boarding time and helps coordinate admissions. Operating rooms are some of the most expensive real estate in a hospital, so even small gains in utilization matter a lot. AI improves this in 3 ways. Surgical duration prediction. Models trained on historical surgical data predict how long a procedure will actually take, more accurately than traditional surgeon estimates, which means tighter schedules, better coordination of anesthesia and nursing staff, and more accurate timing conversations with patients and families. Turnover optimization. AI studies the gap between one case ending and the next beginning, spots the bottlenecks, and helps coordinate cleaning crews, equipment prep, and patient transport to shrink that downtime. And case scheduling. AI builds or schedules around surgeon availability, equipment needs, and patient acuity to maximize use of the room while keeping safety margins intact. Staffing is another place AI is making a real difference. On the demand side, AI predicts patient volumes and acuity across units and shifts, which lets hospitals call in extra nurses before a surge hits, rather than after a unit is already overwhelmed. direct float staff to wherever they're needed most, and build schedules that respect safe work hour limits so burnout-inducing patterns don't creep in. On top of that, AI handles skill-based assignment, matching what a patient needs with what a staff member is actually qualified for, so patients with complex conditions end up with nurses who have the right experience and certifications. AI is also reshaping the healthcare supply chain. Demand forecasting predicts how much medication, supplies, and equipment a facility will need, based on scheduled procedures, seasonal patterns, and how many patients are currently in the building. Expiration management tracks inventory so supplies don't quietly expire and go to waste. And automated reordering triggers purchase orders based on predicted demand instead of a fixed reorder point that doesn't account for what's actually happening. This matters in a crisis too. During the COVID-19 pandemic, health systems that had AI-powered supply chain tools in place were better able to anticipate and manage shortages of PPE, ventilators, and medications. Let's recap. AI-powered scheduling cuts no-shows by 15 to 25% through prediction and targeted outreach. In the emergency department, AI optimizes flow with arrival prediction, triage support, and real-time bed tracking. In the operating room, it improves utilization by predicting surgical durations, tightening turnover, and building smarter schedules. Demand-based staffing models help hospitals allocate nurses and support staff proactively instead of reactively. And AI supply chain tools forecast demand, cut waste, and automate reordering to keep critical supplies on hand. Head over to the lesson page on Free Academy AI and try the interactive prompt playground yourself, or paste a scheduling scenario into an AI assistant like ChatGPT or Claude and see how it responds.